But these panel tests are several dozen to several hundred different genes analyzed using the same technology as one would use for whole exome sequencing. And so we could order a panel, let's say, for developmental disabilities, and that panel may be 200 or 400 different genes. And it gives you a more refined look at the genes of interest without cluttering up your data, looking at genes that have nothing to do with the patient's clinical phenotype. I personally prefer the whole exome technology for a couple of reasons. I do admit that it does give you sometimes excess information that it really is not going to be clinically relevant to that child's situation. Yes, that's true. But the panels aren't perfect either. And one of the problems with the panels is that if the gene itself is not included on the panel, it never gets analyzed. Whereas with the whole exome technology, it gets analyzed whether or not there's never been a single patient ever reported with a mutation in that gene. The importance of which is that at a later time, you can go back to that mutation and actually try to figure out if that mutation in fact was clinically relevant. When you order a panel, you're putting at risk any information that is gleaned at some point in the future. When we want to use both tests, I think it's important to use the same laboratory that has performed the first genetic test that will perform the second genetic test. The reason is that there is some overlay in the information gleaned from the chromosomal microarray that can be very helpful in interpreting the results of the whole exome test. And when you have the same laboratory doing both tests, you have the same set of scientists that are sitting in one room that can actually refer back to the details on the chromosomal microarray to, again, best interpret the results of the whole exome test. I think that there are two main approaches right now if you really don't know what disease that you're dealing with. Obviously, if the child looks like they have Fragile X or some well-defined disorder where you can order a single genetic lab test on a single gene to give you an answer, that's the way you should go. But if you're up against a situation where you really don't know exactly what disease that you're dealing with, there are two main lab tests that I use in my clinical practice to reach a final diagnosis. The first test is the chromosomal microarray. This test has been around for over a decade. It's now well refined and a very robust test. By and large, it's pretty much replaced the karyotype for looking for genetic disorders that involve deletion or duplication of chromosomal material. If the chromosomal microarray comes out non-informative, then we will often want to look for single gene defects. The whole exome technology allows us to look for these point mutations as well as very small deletions, duplications, and insertions in these genes.